It's September the 28th. I know September the 28th, that's my sister's birthday. But nevertheless, as of since last Friday, you know, I regretfully have to report to you that we've lost 7 more West Virginians. Our death toll now is 337 in West Virginia. The 331st death was a 70-year-old male from Logan County. Our 332nd death, a 62-year-old female from Logan County. Our 333rd death, a 70-year-old female from Kanawha County. 334th death, a 72-year-old male from Kanawha County. 335th death, a 70-year-old male from Kanawha County. 336th death, a 77-year-old female from Taylor County. And our 337th death, a 92-year-old male from Berkeley County. Again, it's really, really, really easy to see that where this terrible killer attacks. The youngest person that I'm announcing today out of the 7 is a 62-year-old female from Logan County. With the most elderly, a 92-year-old male from Berkeley County. Each and every one of these people have been great, great West Virginians, I'm sure, without doubt. And they have been absolutely loving family members that have passed on wisdom for decades and decades. And I truly want all of us to be thankful for these people and to absolutely never let them become just a number, and absolutely keep all their families, all their friends, everyone in your thoughts and prayers, because even though 7, the way it's been going, to be perfectly honest, is surely better than naming 12 or 13 or 15 or whatever names, but or individuals. But it seems like, and even feels like, this thing is starting to move our way. You know, I won't promise that by any stretch of the imagination, because it just feels that way to me. So 7 is 7 too many. Maybe it's less than we've had, and that's better. But please keep these people in your thoughts and prayers. We had new positive cases in the last 24 hours of 164. Our daily positivity percentage is 4.01. Our cumulative positive is down to 2.75, I think from 2.78 or something like that, or down from 2.79 on Friday. You know, our total active cases still are just slightly under 4,000, 3,987. Our recovered cases are in excess of 11,000. Our total hospitalized are 168, you know, and all those numbers are seeming to hold. But here's the number that leads me to a better feeling about where we're going. Our RT number, our reproduction number, is at 0.98. Now, it's been a long time, and not forever, but it's been a goodly amount of weeks that we have been well in excess of 1. And when you get under 1, that means as far as our spreading capabilities, they're being diminished, and they're being diminished to a better and better number. Now, we're now the 15th best rate in the country, and that's good. That's really, really good. We've come a long ways, West Virginia, and you're getting better. You know, in our daily county alert system map, we do not have any counties in red, and we only have 2 counties in orange, which are really good. Now, I'll get back to that in just one second. On our Saturday education map, we had 2 counties in orange. That was Kanawha and Wayne. We have 2 counties in orange today, which are Kanawha and Barber. In our daily education map, we had 4 counties in gold: Mingo, Logan, Fayette, and Summers. All the rest of the counties were in yellow and green. Now, as far as our outbreaks, we have now currently 17 active outbreaks with 52 confirmed cases in our public schools reported by our Department of Ed. And this information is completely available, transparent on the website. Now, I want to just talk just 1 second about that and just say just this. All of us have known that when we go back to school, there's an additional level of risk, and all of us know that we're going, none of this is going to be perfect. All of us know to expect outbreaks here and there and everything, and we run to those fires and we try to handle that and do all the contact tracing, everything that has to be done, and keep moving forward. Keep trying to live with this, terrible virus until we do get that vaccine. But we all know, all of us are way, way, way too smart to not know that really and truly, when you go back to school, when you open a restaurant, when you do anything, we're going to have additional cases. And so just keep that in mind, and absolutely we're just going to keep running to the fire, and we're going to keep trying to put all these things out as prudently as we possibly can. Now, as far as our free testing, and I really want everybody to dial in and pay real attention here. Our free testing continues to ramp up. The National Guard came out right out of the get-go and said, we're testing 3,300. We need to be testing in excess of 7,000. We want to test 10,000 every day. To do so, you'll see on our website, you've got all kinds of additional spots that we're going to be and when we're going to be there and everything else. But I want to dial in to one county right now, and that's Kanawha. The kids in Kanawha County have not been back to school, and we want them in school. We want them in school so badly, but we want to be safe, and we want to be ultra safe to the county, to all the residents of the county, to all those that are in the schools, whether it be the teachers or the service personnel or the kids. We want to be super safe. Now, to do so, we have got to have the effort in order to be able to get back in school. We have got to quit just testing people that are sick and the most vulnerable people. And what I mean by that is just this. If that's the only people that are showing up wanting to be tested, then we're not getting a true cross-section of the whole county. So, what we've got to do, there's two different ways that we can get to where we're wanting to go, but they are one and the same. And it's just this. If we test, and we test in a bigger way. You go way back when we were trying to figure out how to handle our unemployment claims. And what we did is I told General Hoyer, I said, double your capability. No, I said triple your capability. And then that still didn't get it done. And I said, triple the triple. And then all of a sudden, boom, we were able to really, really get going. Now, from this standpoint, what we need to do is blanket the orange counties and, God forbid, a red county. And we need to test and test and test. So at my direction right now, the National Guard and DHHR are standing up for additional free testing. Tonight, from 3 to 7, tonight, tomorrow night, and on Wednesday night, we'll be at GW, in the parking lot at GW, testing there from 3 to 7 tonight, tomorrow night, and Wednesday night. In addition to that, we'll be there from 9 to 5 on Thursday. And also this week, we have free testing events set up in Kanawha County in Elkview, at Elkview Baptist Church, South Charleston High School, and Riverside High School. With these 4 events this week, we have Kanawha County now covered and from a free testing standpoint, and we want everybody, we strongly encourage everybody to come out and be tested. Now, we're going to do the same kind of effort in Barber County, and we're moving to do so and you'll have details in regard to that as quickly as I can get them put together, and they'll be posted and be brought up. Now, let me just tell you just the perfect example of exactly what we're trying to do with the testing effort. We're not just trying to get counties in the orange or in the yellow or the green. We're not doing that at all. I mean, that would be great if we did that and our kids were back in school and we were able to play ball and doing all, and that to me would be absolutely wonderful. But hear and follow the example, because this is so much the example. The Bible Center stepped forward and said, here's what we're willing to do as, one of our private schools or a Christian school. Here's what we're willing to do. We're willing to test all the kids that are here at the school, all the staff, everyone here. And so we go about doing that. And we think it was a noble and a great idea and everything, and it got us past an impasse and everything, and so we go about doing that. Now, on the information that I have right now, as we speak, we had 220 some odd people that were tested, kids primarily and staff and everything. Every single one was negative with the exception of one. And we're doing the retesting on the one right now. Now, just think about this. If by chance they're all negative, great. But if by chance one is found that's positive, just look at what that gives us. That gives us the ability to isolate that individual, to make sure that they're okay, and to prevent them from causing 30 others at the school to be sick, and then them causing 30 more, and before you know it, it's just one right after another, and we can't find a solution to the problem. So you see, the bottom line is just this. The more we test, the more we learn. The more we absolutely test, we are going to find. We are so looking for those 5 or 6 or 8 or 10 or 15 or 20 or whatever it may be, spreaders that are out there, and if we don't stop it, we'll never be able to get our arms around this in Kanawha County and shut this down. This is exactly what we need. This is exactly why I say this may be our best moment. And by that, I always say our best moment. This may be the key right here. If we're able, the more we test, the more chances we're going to be able to find people and then isolate them and stop this thing. Stop it in its tracks. So please, Kanawha County, take advantage of all this testing. Get out there and get with it. We're going to do the same thing in Barber County as best we possibly can. And absolutely, we're going to stop this thing. We're going to win this war. We're already, I feel like we're moving in the right direction, and I feel better about it right now and everything. I hate like crazy we lost those 7 great West Virginians, but I feel in my gut that we have an opportunity here to go and to get this thing and to be able to put a stranglehold around this terrible killer, and that's what I want to do. I want to stomp it out. As far as flu vaccines, I continue to encourage everyone to get your vaccine. Everyone, I guess 6 months and older should get a flu shot, and at some point in time they informed me that I was such a wonderful guinea pig on getting tested for COVID that I'm going to have my flu shot. And I think they're going to try to get that ready maybe for Wednesday or Friday, and I'm going to pull up my sleeve and let everybody see me getting my flu shot, and so maybe that'll encourage everybody to get all their flu shot, or all of them get their flu shot. Okay, we have 37 outbreaks in our long-term facilities. Our churches, we've bounced way up. We now have 5 active outbreaks in churches in 5 counties. Tucker County is a new one. Harrison County, Nicholas, Fayette, and Kanawha counties. Again, don't let your guard down. Please, please, let's not let our guard down. You know, keep a pew between you. Wear your mask, wear your mask, wear your mask. All the social distancing, wash your hands, everything. Come on now. Don't drop your guard, West Virginia. Please don't. From the standpoint of corrections, we have 8 positive inmate cases. We have 7 at Mount Olive. We have 1 at North Central now. We have 21 active staff cases. 15 of those active staff cases are at Mount Olive. We have 8,000 applications now that have been submitted, you know, as far as the small business grant program. We have over $21 million that's been awarded, and that's all good and everything. We're kind of nearing the deadline on the application process there. I think the deadline's going to be here in a couple of days, so try to get your applications in if you don't. But we were really proud to be able to get out $21 million, and hopefully we can get out a few more dollars than that before the end of this. From a standpoint of our cities and our counties, we're up in excess now of over $121 million. Good stuff. We've got 191 cities and counties that have applied so far. I continue to urge you to go ahead and apply. And from a census standpoint, we are still first in the nation. We're at 99.9% and tested, and Idaho and Hawaii both are right under us at 99.8%. West Virginia, you did a great job with that. And the only last thing I'd like to add is just this. You know, as our panel went through everything and they came up with all their recommendations on Saturday, and I really, really commend not only, you know, I mean, first and foremost, you see all the great work that's going on, you know, with our DHHR and all of our health community and everybody, from our National Guard right on up through everybody, all the great work that they're doing. The panel that comes in and assesses and evaluates these numbers, I can't thank them enough. They've gone through and they, you know, on our education map and everything, and they went through and weighed this and weighed that and made sure that, you know, all the numbers were correct and everything. And so I commend them for the work that they do. And they called me with the results, and I said, all that sounds, you know, very good, and we went with that. But the other thing I'd like to do is just take 1 second and just say just this. Think about a county like Mon County. Think about a county like Cabell County. Think about counties that have dropped drastically in the color code with a tremendous improvement. How do you feel in that county? How do you feel? I want you to feel really good. I want you to be really happy about how you feel in that county. But I also want you to still be afraid to some degree. I want you to still be concerned, because really and truly, this thing is still right with us. You know, this thing is a killer. It takes life. So absolutely, continue to do everything in your power, everything you can possibly do to be as safe as you possibly can be. Protect yourself, protect your loved ones, especially look after the elderly. But absolutely don't drop your guard. Just because your color code dropped, and all of a sudden now you're in the green, it doesn't mean that, you know, we can just run through the streets with our mask off and everything and all be good. Now's the time to really and truly, as just this is on my sheet every day, it says, now's not the time to panic, it's a time to be cautious. Now is the time to be cautious. Now is the time not to be fearful so much, even though I told you to be afraid to some degree. A little bit of fear is great stuff. But it's a time also to be smart. It's a time not to be weak. It's a time to be West Virginia strong. Don't drop your guard just because your color code changed in a favorable way. Absolutely, just stay on guard. That's all I've got right now. Thank y'all.
All right, thank you, Governor. Let's first today go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. I give everyone an update on checks out and contact tracing. I spoke weeks and weeks ago about transitioning to a new surveillance system for the state of West Virginia. The system we had in place was decades old and was not up to the task. On September 12th, the final 14 local health departments in West Virginia went live with checks out and our new contact tracing platform. This completed the transition, and now all new COVID-19 cases from West Virginia are contact traced using this new platform. Once older cases are closed, so there are still some cases in the old WVED system. But once those cases are closed, this will be the only platform used for case investigation and contact tracing for COVID-19. While this significantly modernizes our contact tracing data system overall in the state, a primary advantage of the platform is that contact tracing can be completed on a secure cloud-based platform by properly trained and supervised staff. So this means contact tracers can work remotely. Prior to the implementation of the new system, we had approximately 350 people routinely performing contact tracing throughout the state of West Virginia. Now we can mobilize an additional 150 volunteer staff who were trained by either WVU or by DHHR to do contact tracing. This gives us the ability to increase support for local health departments in the areas of case investigation, contact tracing, and data entry. Any local health department can request additional contact tracing services through DHHR. We have capacity, we have the ability to provide additional help. If you need assistance, please contact us and let us know, and we will immediately complete what needs to be done in a very short period of time to provide that assistance. As we move forward, there are additional features in this new surveillance system that we'll be looking to roll out. We're trying to do this carefully. We appreciate our partners at the local health departments in helping us to roll this out smoothly. Everyone did a terrific job, and I thank you for that. One other issue I wanted to just mention that West Virginia was a finalist in a development of the state's coronavirus dashboard with the Center for Digital Government. Our dedicated staff at DHHR's Office of Management Information Systems has worked truly long hours to make the information accessible, easy to read, and visually transparent. We're trying to move more information to that dashboard, and we're going to move more information to that dashboard so that all of the data is there to make those calculations, if you like, with regard to the data itself. I want to give a special thank you to Tim DeBar, who has truly worked long hours. When I talk about receiving emails in the middle of the night, Tim is generally the one to do that, although Amy Atkins and others are also working around the clock to try to make this thing easy for folks to understand. And I know it's a lot of data, so we're working hard with that. But I want to thank Tim for his work and tell him that we truly appreciate what he's doing. I'm proud of our team. We have a great group of folks, so I know this is a difficult process, but we're going to try to be as transparent as possible and provide as much information as possible in the future. Thank you.
All right, thank you both. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out, the National Guard is significantly engaged in testing throughout the state, and particularly in our counties that we're continuing to try to move forward. We also are engaged in a number of disinfection and sanitization missions across the state to include Mount Olive Prison. We'll be moving in quickly to support City of Charleston with an outbreak that occurred in City Hall. Continue to work on the Wi-Fi initiatives, and we'll be close to finishing those by Wednesday to provide more bandwidth with our Department of Education partners to our children who need that available. Last thing I'd like to talk about today is I found out some significant information this morning from the Department of Defense that since day 199 of the pandemic, the United States military has experienced a 20% increase in suicide rate among military personnel. If you just stop and think about the bandwidth of the work just in your West Virginia National Guard, 1,000 deployed service members, bringing folks home, sending folks on deployment in the middle of a pandemic, stress on families, and then the over 700 men and women in the West Virginia National Guard who've responded and continue to respond within minutes when requested here, puts a significant amount of stress on our force. So I ask all of our men and women and their families to pay attention. I ask our public to pay attention to those folks out there and help where you can. We have a number up on the screen for West Virginia National Guard personnel. We also need to think about the health of our population in general, our school children, our other state workers and frontline healthcare workers, and pay attention to that. And I would ask all of us, if you think about the implications of that, as the governor said, go get tested. If you're the significant spreader, we need to get you off and isolated so that we can take care of each other and we can push this in the right direction. So go get tested in support of those people on the front line attempting to help keep all of us safe. Thank you.
All right, thank you, General. West Virginia Superintendent of Schools Clayton Birch is also joining us today and is available for questions. Dr. Clay Marsh, our coronavirus czar, had a prior commitment today, but he will join us again later this week. We'll now go to questions from members of the media. The first today from Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Obviously, we can't focus in too much on social media chatter, but one thing I keep seeing over and over, and I think it might be worth explaining, is people are saying the numbers to go back to school are manipulated. And I know there are different calculations and different ways that you're coming up with those numbers. Can you talk about the science, quote unquote, behind that, and also what exactly people should think about when they compare one map to another that's on the dashboard?
Well, Amanda, let me start off by just saying this. You know, I really probably take terrible offense to someone that would say that we are manipulating numbers. You know, first of all, I take an incredible pride in the one thing that I will always do with you is tell you the truth. An incredible pride with that. You're not going to catch me telling anybody something that I absolutely know to be wrong. Now, I make mistakes, just like anybody makes mistakes. But there is no chance on God's earth, not one slither of chance, that I'm going to put up with us in any way manipulating numbers for any kind of outcome. But maybe Secretary Crouch or Dr. Amjad can answer it, and y'all can add something to it if you would, please.
Sure. Thank you, Governor. Hi, Amanda. I think what happened in terms of the initial efforts, and we talked about this before, we inadvertently had a system whereby the incentive was to not test. And as the governor said a little earlier, one of the worst things we could do is not test and have individuals who are positive out there roaming around who then become, within a week, if you have 10 initially that you don't find, then you end up with 30, then you end up with 60, then you end up with 90. It's that exponential growth that we're working very hard to try to make sure doesn't happen. So the change to the positivity rates and the science behind that is sound from the standpoint of we're looking at counties below 16,000 using a 7-day rolling incidence rate and positivity rate, and then going to a 14-day rolling incidence rate and positivity rate for counties with a higher population. So we're also looking at case counts. If you have less than 20 cases in a county, then other federal agencies who do this and have done this for forever public health agencies suppress that data because it's not reliable from the standpoint of the numbers needed to know you have a sufficient count there to have accurate data. So we are following the science. We do not manipulate these data. We make very, very careful decisions regarding how we do this. So there's science behind this. The idea of adding the positivity rate again was to get more people tested. If we don't test more people in West Virginia, we're not going to beat this disease. Ann, do you have anything to add to that?
Sure, Amanda.
Might talk a little bit about Marshall County. We had a change there in Marshall County Saturday, so we're happy to talk about that as well.
Sure. Let me add to that, Amanda. What people need to realize is that by testing more people, we're adding more opportunities for people to find out if they're positive. And regardless of the color of your county, you can see that in each county that we have, if you're a positive student or teacher or adult in those counties, those are being addressed at the school level. So as long as the efforts are being made to identify cases, which is through testing, which we're offering that more widely right now, these are being identified at the school level. So we're making this more available at each county, which is what we need to do. We need to identify these cases aggressively so that we can find these at these levels. And regardless of that county color right now, these cases are being identified so that children, teachers, adults are not being infected at the schools. And you can see that being identified daily in each county. So that is being identified. And in addition, Marshall County is a good example. Over the weekend, our team did meet, our review panel did meet, and we did identify where it was moved to gold. But however, the local health department did call us and was concerned about that. So we reviewed it again. And there was one case that it was misidentified. It was duplicated due to an error right there. So we reviewed that, very carefully, and it moved them back to yellow. So we are very careful of how these cases are identified. We go over them very carefully. So there's no change in any data because these things are looked at very carefully. So in that sense, it's very important to test people to identify cases for the children's safety and adult safety at school.
All right, thank you, Amanda. Next is Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here, and I'm going to kind of piggyback a little bit on Amanda's question. I know, Governor, you were talking earlier about obviously trying to encourage counties that are in the green or in the yellow that have come down to obviously, keep their guard up. Just because you're green doesn't mean that you stop wearing your mask or that you stop social distancing. But in many cases, in these counties that have changed to a better color, the numbers of cases, active cases, have not gone down. They've, in many cases, gone up. Putnam County, I think, is a good example of that. Now, I know that testing is also up, which is certainly a good thing. And I know that was the goal of changing the metrics to some extent. And I don't want to say manipulation, but just going off different set of numbers, your cumulative positives. But, I mean, we still have issues with higher numbers of cases. And like I said, Putnam County is a good example of that. Their case numbers, active case numbers, keep going up. They're not going down. In the case of Monongalia County, for example, I mean, their numbers are starting to come down, but we're also subtracting out, students that are, self-quarantining, in the Arnold apartments there. But that's not even all of the, active cases that are spread out on their campus. That's just one sliver. So can you talk a little bit about some of these issues that kind of remain, just because even the counties are getting better, doesn't mean that cases aren't still accumulating in those counties? Thank you.
Sure, Stephen, and you got several different facets to your question, but let me just make a stab at it as best I can. Let's just take Putnam County. Let's back up just one step before I go to Putnam, and let's just think about just this a second. Think about as we moved forward with the color code math that I think Secretary Crouch just touched on this just a second ago, but we were awarded being a national finalist by the CDC or whomever it was and everything. I don't know exactly who it was, but as by saying the goodness that all the reporting, all the color coding, all the stuff that we have come up with, that they were congratulating us as a national finalist. Again, in West Virginia. Good stuff. Really good stuff. But now just think about this just for a second. If what we did was we just continued to do nothing but test the sick from an infection rate. If I'm in a county and I want our kids back in school, or I want my kids back in school, or I want, to play sports or whatever, and I'm publishing a color code system, and all I do is test, and let me be ridiculous to make my point. All I do is test 10 people a day in Putnam County. And those 10 people are the sick people. And the reason, the first thing that I do is say, well, the more we test, if all they do is just count the number of people that are infected, naturally the number's going to grow, and Putnam County is never going to go back to school. Well, that is the worst thing that we want to do from a standpoint of motivating people to test. Because people we know were not testing. And the amount of tests that we had were lower than what we wanted, significantly lower. And so we're doing it the wrong way. Then we need to do it in a situation that absolutely brings down the total number of tests that are positive. But the only way we're going to bring those down is identify the people that are spreading this disease. How are you going to do that? You got to test more. When you test more, naturally, in the beginning, without any question, the number of infected, let's just say you go to Putnam County, instead of testing 10, you test 1,000. Well, instead of getting 3 positive tests back, you get 45 positive tests back. Well, all of a sudden, it looks like, from an infected standpoint, just purely infected, that number rises. Well, of course it does. But from a standpoint of the number of tests taken, the percentage of positivity goes significantly down. So our great health experts, education experts, and all decided that absolutely it made all the sense in the world to look at both metrics and go whichever was less. Now, nobody needs to take responsibility for that except me, because at the end of the day, I said, wait, we're doing this wrong, and we have got to find another metric that aids in getting us to test. I'm the person that said, let's do it both ways and/or whichever's less, because it gives us the motivation to test. Now, so that's what Putnam's doing. They're testing. That's what Kanawha needs to do. Test. The more we test, the more we know. We absolutely should, and one part of your question was WVU. We had a food fight going on between the city and the county and the university and everything, and they're all great. And they all should be embracing one another, and absolutely, I know that they do. But we had an issue there, did we not? And so what we did is just this. By the great leadership of Gordon Gee, our great president and the great people on our county commission and the city managers and all the people that are, the mayor, and all the health officials in the county, we came up with an idea. Let's say what we do is pump as many people off WVU into Arnold that we possibly can. We get them well, and we get them not out exposing everybody under the sun, and we make progress, and lo and behold, what happens? Our MON numbers start coming down. Our infected numbers start coming down. That's exactly what we are very hopeful that will happen in a Kanawha or Putnam or Fayette or wherever it may be. But as we test, the given is if you test 1,000 instead of 10, the number of infected on the left hand's going up. We know that. I mean, for crying out loud, everybody knows that. You know, but on the other side, our positivity percentage could be much, much, much less. And then we take whichever's less and we go on about our business, but every day, because we have tested more, it is as simple as mud. Because we have tested more, we're able to isolate those that have it, that didn't even know they had it, and be able then to get a grip on this in a Putnam County or whatever county it may be, and bring our overall numbers down. Now, in the meantime, Stephen, you're dead right. You're dead right about one thing for sure, and that is this. We are identifying in those counties that we got a lot of people out there that have this. And those people we're shoving to the sidelines, and we're trying to isolate them and let them get well without infecting others. Granted, we're doing all that, right? And everything, but we should be very cautious in all of our counties, because absolutely this killer is right with us. And the more we're cautious, the better we'll be. So absolutely be concerned, be cautious, and be smart, and be strong, and keep doing that. And as we identify these people that don't even know they've got it, we're going to win this battle. And that's the whole gist of everything. It's just as simple as mud to me. You know, if you just, all you do is don't test, then you're just sticking your head in the sand. But the more we test, the more we'll know, and the more we confirm that the people that have gotten this, and we isolate them and let them get well without infecting others, the better we'll be. That's the only way to win this. That's why I say over and over, that may very well be our best work right there. And absolutely, massively, aggressively testing. And that may be our best work. So I hope and pray it will be anyway.
All right, thank you, Steve. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor, and everyone else, cabinet members, press. Let me ask a follow-up to Stephen and Amanda's questions, because I got a very concerning call here in the newsroom this morning, and I will just characterize it as a parent in one of the metro Charleston area counties who's very knowledgeable about the athletics in that county and is very involved with it. And his concern was that some of the athletes, either of their own volition or they're being encouraged by others to get multiple tests. They've been tested 3, 4, 5, 6 times in recent weeks in the effort to perhaps build up the number, a large bubble of negative tests, so it drives the county's color down collectively, and they can play sports if they get the number down to yellow or orange. So I'm going to ask you to address if you're concerned about this multiple testing by the athletes, and then I'd like to specifically have Dr. Amjad address just how often should these athletes be getting tested.
Mark, I hope to goodness that we have not stooped to that level. I mean, I've not heard, you're the first person that's told me that. I'll check into it and find out if there's any truth to that whatsoever. But surely to God above, you know, we don't have coaches that are out pushing athletes to go do something that they know better than. I mean, you know, what kind of an example would that be? I mean that would be terrible, you know. But I hope to goodness that our athletes will all go get tested. I hope that we'll have the situation. I can't better explain it than just what happened at the Bible Center. If in fact we tested 225 people at the Bible Center, all the kids and the staff, and we did find one that's positive, what if we didn't know it? What if we didn't know it? How many would that mushroom to? You know, it doesn't go from 1 to 10 to 20 to 30 to 40. It goes from 1 to 10 to 20 to 40 to 80. That's the way that moves. And so from a standpoint of just that, you know, the testing idea is rock solid. Surely to God above, our coaches are better than trying to dupe the system and run athletes through multiple times. And so I just, again, I go back to the Bible Center and thank them, and thank them for the great work that they're doing there, and how much help that they are providing to the entire county. I mean, they're helping the whole county in every way. I mean, think about it. If all their numbers impact the county in a positive way from the standpoint, it drives the numbers down and it makes the colors better, yay, yay. But the biggest thing of all, if that one person at the Bible Center, we isolate that one person, and they're not in Walmart infecting people, or they're not, wherever it may be infecting people, that is a tremendous, tremendous aid to us. But Mark, I'll check. I have not heard that from anyone else, and I'll check. I hope that it's not true. I don't really think it is, but I'll check it. Dr. Amjad, if you want to follow up on that, please.
Sure. Mark, I agree with what the governor said. If there's someone or some coaches that are doing that, I don't find that acceptable. Testing is out there to find individuals who are possibly transmitting the disease. If we are testing athletes, it's to find those who are asymptomatic or who are sick. That's not a good example for young people, or example that we're trying to set out there. There are, of course, professional athletes that get tested multiple times. Those are professionals or college students doing that, but that's not the example we're setting out there for young people or for West Virginians. So we'll check into that, but that is not the example that we're trying to set. We do want children safe if they're practicing or doing sports, but we'll look into that, but that is not what we do.
All right, thank you, Mark. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. My question today, it's really for Superintendent Birch. I just wanted to follow up a little bit. On Friday, you had referenced House Bill 206, which released funds for the hiring of additional support staff in the schools. Are those funds available now? Is that something where X amount of dollars will be released on such and such a date? Basically, when would the hiring process be underway if it's not already? Thank you.
Thank you. Yeah, I did reference House Bill 206. Those are in state aid funding right now. They're available for this year to increase support staff. And as I indicated, it allows for over 500 additional support staff. That can be counselors, social workers, school nurses, anything in the support staff realm. It allows for that. So those funds this year did equal nearly $25 million.
All right, thank you, Matthew. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. As you know, Kanawha County is a very large county. George Washington is just one of the high schools. Why the focus on multiple testing events the next few days, specifically at the George Washington area? Who made that decision and what was it based on? Thank you.
Brad, it just came to me that to get a representative cross section of the entire county, it was recommended to me that we go to George Washington in that area, but also I think we're at Elkview and Riverside. I know we've been at the West End a whole lot and everything. We're also at South Charleston. We're going to be all over the county and everything. But it was just recommended to me that we need to be, that area has been kind of left out a little bit, and we just want to have a representative cross section of the whole county going on all the time.
All right, thank you, Brad. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, I know you get a lot of calls. I think everybody on this call gets a lot of calls. I got one over the weekend that was kind of interesting. It was from a restaurant bar, and I said, okay, how are things going? And they said, well, we're doing all right. We're wearing our mask. We're socially distant, but we got a problem. I said, okay, what's your problem? And they said, The bar down the street is not requiring anyone to wear a mask. So when people come to our place from that place, they're wondering why they have to wear a mask at our place. And it seems that they are being penalized for doing the right thing. Competitively, the bar down the street is doing big business because they don't have any restrictions, or at least they're not enforcing any of them. Is there someplace that they should call to complain other than me or you?
I think they ought to call the ABCC, you know, from our side to complain, and we need to know about it, and we'll follow up on it. You know, that's not right, and the local health department, I'm sure, can help, but we can help on our end too. So please just tell them to call, and we'll follow up on it because that's no good, you know, and you know, it's impossible. You know, everybody knows it's impossible for us to police and look after every establishment all across this state. But you know, if we have the aid and assistance of people and the eyes and the ears of the people out there, if they'll let us know, we'll follow up.
All right, thank you, Paul. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Secretary Crouch. Could you talk a little bit more about the features of this new surveillance system and how does switching to this new system improve the speed and accuracy of all of this data we're gathering? Thank you.
Governor, okay?
I'm sure. Yes, sir.
Yeah, yes, Charles, that's a good question. What I'd like to do, and I don't want to avoid your question, but I don't have that level of detail with regard to the differences in the two. The new system is much faster, much broader. It provides a way to do investigations online. It actually has functions to help schedule testing. It's got a broad range of abilities that we have not implemented yet. So what I'd like to do is have someone come on in the next week, maybe later in the week or the first of next week, and provide that information to you and to everyone so you can hear a little bit more about that. There are a lot of features that we have not implemented yet. I know I mentioned a couple of months ago, we were rolling this out in a very short period of time, just specifically for the contact tracing piece, because we knew that was a concern in the state. If we don't have enough contact tracers once we identify the cases, and now that we're testing more, we're identifying more, that was the priority, and that's why we rolled this out early. So these other features, as we're ready to roll those out, we can talk about, but we're happy to give you a summary, a better summary than I can give you right now. Good question. Thank you.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. And Governor, to run the risk of offending you, which is certainly not my aim, and along the lines of Amanda and Stevens and Mark's questions, many people have contacted me expressing continued confusion and frustration with both the Department of Education and Department of Health and Human Resources maps. I don't think I'm saying anything new here. They claim the state could not get children into school by counting the total infection rate of a county. So it was switched to percentage positive of total tests, which is easier to get those kids into school. The more you test, of course, the lower the percentage goes. But they say nothing has changed, as Stephen said, as far as total infections, so that risk hasn't gone away. They contend the constant map tweaking and use of a medical panel, which has the final say, is designed at least in part to placate parents, the vast majority of whom want their children in school, to be able to say classrooms are safe, to counter any claims otherwise by unions and your political opponents, and all with an eye to help win an election in 5 weeks. So what do you say to those parents that you haven't said to convince them the moves which have been made are purely health-based and not part of any Machiavellian plan? And how do you keep or win back their confidence, most importantly, in a system they say they've lost confidence in and are frankly fatigued with the changes and the mechanics of this pandemic? Thank you.
Well, Kenny, I hope and pray they've not lost confidence in, and I hope and pray that they're not fatigued badly, even though I'm sure that they are to some degree. And all of us have got to totally realize, and I equated this to the moon landing as something that I'm sure was in lots of ways many, many more times more complicated. But at the same time, this is something that none of us have ever dealt with before. And in 4 or 5 weeks of a color code system that the CDC has now come out basically and with almost a mimic of ours, some 2 or 3 weeks after ours, and all of that has gone on from the standpoint of, from day one, the unions, all basically jumped on board and wanted all states to follow a positivity rating, of less than 5%. We surely tried to do that. But from the standpoint of, Kenny, it's just as simple as this. I mean, we were at an impasse. We wanted people to be able to test. And from the standpoint of getting your kids back in school, anybody that had a test affected that result in a negative basis. That's all there is to it. Because the more you tested, the more infection you would find. And the more infection that you found, every one of those counted, and especially in our smaller counties, but they absolutely just blew our smaller counties right off the board. Now, and so what happened? People started not testing. Well, we need people to test. That's all there is to it. And so from the standpoint of the guideline established by the teachers' unions and from the service personnel unions, from the guidelines of that, then what we did is we came up with another metric where we could use both. Now, it's working. I mean, say what you want, but it's working. We are absolutely identifying more and more people that we need to be able to treat and in order to be able to stop this thing. Now, I can't defend it any more than that. I mean, we can say, well, let's just don't test and let's just jam our head in the sand and everything. And lo and behold, then, what are we going to do? I mean, at the end of the day, if we don't test, we jam our head in the sand, and really and truly then all of a sudden we have outbreak here, outbreak here, outbreak here. We're still going to have outbreaks. We're still going to have to deal with tough stuff. I mean, it's just as simple as that. But the more we test, the better shot we'll have to shut this thing down. And so I'm very pleased with what we're doing, and I know it's difficult. I know it's confusing. I know it's all those things. But our people and the great health community and education community and all those that are putting in the licks to make this thing really work, they're doing a great job, a great job.
All right, thank you, Kenny. Next, Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Well, to follow up on the other questions, for parents looking at the West Virginia version of the risk map today, there's 0 red counties, only 2 orange counties. But if you look at the original Harvard Global map, 2 counties are red, 15 are orange, 34 are yellow, and only 4 are green. So we have mostly a green map. Harvard Global has a map of multiple high risk colors, and parents look at that and which map are they to follow? And you have Harvard Global experts who've been highly critical of some of the changes that West Virginia has made to the original their original risk map. So how do you build confidence for parents who are looking at the Harvard Global map and saying things aren't quite as safe as they seem?
Okay, Phil, I don't know how many times I've got to go through this, but Dr. Marsh isn't with us today, but he has explained over and over and over exactly the reasons why we think a deviation is wise from the Harvard map, because the one-size-fits-all situation maybe isn't just the best way to go. And I don't know why in the world that just all of a sudden you think that the Harvard map is a better map than the experts that are right here in West Virginia are doing and everything. I mean, these people aren't doing something, that they feel like is going to hurt us, in any way. They're trying to do the right thing and adapt West Virginia into the Harvard map and make it work. I can't help it that the Harvard people want to criticize. The Harvard people naturally want their map to be one size fits all. But look what the CDC is doing. I mean, look at what they've done. They are adapting our map. And not only are they doing that, but they're giving us awards for doing all the greatness that we're doing. And look at Kentucky. Kentucky just moved to our map. I mean, are we going to call up Kentucky and say, Kentucky, why are you not following Harvard's map? It is, we've been through this too many times.
All right, Governor, that's all the questions for today. I'll turn it back to you.
Okay. Here's and I don't know how to say this anymore, just point blank than just this. We got a decision to make, don't we? The decision is really simple. Whether we should test a lot or not test a lot. Where we should test a lot or not test hardly any. If we don't test hardly any, at the end of the day, what will happen to us, sure as the world, is only the people that will be sick will be tested. And our infection positivity numbers will still be high. Now, from a standpoint of if we test a lot, we're going to find people that aren't sick, that are positive, and be able to do something about it. It's just that simple, West Virginia. Either you're not going to test, and then you're going to have people that are going to show up at the hospital or wherever it may be, and they're sick. They're sick. And they're going to test positive. And therefore, your infection numbers are going to go up. And the more we don't find, the sicker we're going to get. Or, on the other hand, we're going to test a lot. And the more we test, the more we're going to find, and the more we're going to be able to do something about it. And at the end of the day, that's how we win the battle. I'm not going to apologize for that in any way. Absolutely, that's the way we win the battle. That's what you put me in this position to be able to do. And that's what I'm trying to do. And so as we go forward, we're going to try to offer as much testing as we possibly can. I hope to goodness that we're able to get Kanawha County back in school, Barber County back in school. I want everyone to know just this. Now I'm speaking to the teachers. Now I'm speaking to the service personnel. Have I not, since the get-go, done every single thing I can do to keep you safe, to keep our kids safe? Have I not done that in every single way? Have I ever told you anything that's not the truth? There's no way on God's earth that somebody's going to manipulate numbers. There's no way. There's no way. Not on my watch. Not if I can catch it. Now, absolutely the first and foremost thing that we have got to do is keep our children, our teachers, our service personnel, all those people safe. And if you'll go back and look at my track record, whether it be shutting down the state tournament or the nursing home visitation or testing all the nursing homes or every single thing that we've done, closing schools, everything we have done, I have done it with the number one thing in mind: to be safe. There's only one way you build this road, and that's safety, safety, safety. But, I say but, and please, 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 use this as your guide. We have got to be able to live with this virus until we get that vaccine. Do we want our kids back in school? Of course we want our kids back in school. Do we give you a choice, parents? If you choose not to send your kids back to school, We have given you a choice. We have busted our tails to be able to give us additional access to the internet. We have absolutely tried to give you that choice. Every county has a choice and a hybrid and an in-school, and we have given the local control to the counties. Absolutely. Do I want Kanawha County back in school? Barber County back in school? Without question. Along the way, as we shut down the state basketball tournament, as we closed our schools and closed visitation of the nursing homes, tested all the nursing homes, and then right behind that, the nation coming out right behind us saying, we're going to do what West Virginia's doing. We're doing what West Virginia's doing. Then did I come out not and say, the counties that are orange, we said in the beginning that if you started school and drifted into the orange, you could continue to go to school. I said, no way, no way. We're not going to go to school in the orange counties. Why did I do that? I did that from the standpoint of our teaching community, our service personnel community, and our kids to be safe. So at the end of the day, the bottom line is we're going to continue to try to be as safe as we possibly can. I want our kids back in school. I want our kids to be able to play sports if they can do that safely. Sports is surely a minor part to the going to the school deal. But at the same time, I'm going to tell you the only way in the world that we can stop this thing is to know where the problems are. Now, West Virginia, please listen to me. The only way I can know where the problems are is test. And absolutely, the more that I test, the more that I know, and the more we'll be able to stop this thing. The more infections we'll have by the more testing, yes. And it's not fair. It's just plain not fair to a county to say, the more testing you have, the more infections you have, and therefore your color is orange or red, and so don't go. On the other hand, if our positivity number goes low enough, and our panel and everybody thinks from our positivity number at being where that it is, that we should go to a lower color, then that is an absolute recommendation from people that are giving you every single thing they've got. And they're smart too. They're really smart. So that's what we're going to continue to try to do. I encourage all those, especially in the orange and God forbid the red counties, to go get tested. Absolutely, the gold is right behind that. But the more that we keep on testing, the more we're going to find out. I mean, how in the world can anybody deny me just this? If I go have 100 tests a day versus 2, I'm going to find somebody that has this dreaded disease that doesn't know it. And I can do something about it. And if anybody can tell me how you can do that any differently than what I'm doing, then absolutely I'd love to listen to it. But I think we're doing the right thing. Thank you all so much.